Welcome to the deep dive. Today, we're wading to one of those areas of public policy that it almost immediately sets off these internal alarms
Yeah, it really does.
because it sits so uncomfortably close to some deeply held ideas
Oh.
about morality, our instinct to punish, and the societal impulse to just deny that certain behaviors even exist. We are talking about sex work. And let's be absolutely clear right at the top. This deep dive is not about endorsing or condemning anything. It's not a moral judgment.
Not at all.
Our mission here is pure policy analysis. We're asking a really fundamental and kind of tough question. What are the measurable, real-world consequences when a society tries to make a persistent human behavior disappear?
Yeah.
Just through the force of criminal law.
That's right. And our source material for this is it's excerpts from a pretty substantial policy paper called Beyond Punishment, Rethinking the Policy of Sex Work.
And what's so useful about it?
Well, what makes this paper so valuable is that it steps completely out of the whole moral debate. It just focuses on the policy mechanics, it analyzes the observable and often, counterintuitive effects of criminalization.
On what specifically?
On public safety and on health outcomes. It's really an effort to just hold the policy up against the promise.
And that is exactly the mission for you, the listener, today. We want you to gain a necessary reality check on how these policy levers actually work.
Mm-hmm.
Do these traditional punitive approaches really align with the stated goal of, reducing harm and protecting the most vulnerable people? We're going to be putting policy intentions right up against what we can actually observe.
The effects on the ground.
Exactly. Okay, let's unpack this.
So where do we start?
I think the first and maybe the most sobering observation the analysis forces us to confront is just the sheer fact of persistence.
Right, it doesn't go away.
The research makes this point so strongly. Sex work is not a modern anomaly. It's not a symptom of some, late-stage societal failure that we could just legislate away.
Not at all. I mean, you look at the history.
Look, the sources point out this activity has existed across all known cultures, spanning centuries. It's endured through totally different economic systems, and it's survived literally every legal framework you can imagine.
It is a persistent reality. And that observation alone, it has to fundamentally reshape what we expect from policy.
How so?
Well, if you look at history, this behavior persisted through times when the penalties were draconian. We're talking fines, imprisonment, corporal punishment.
Sometimes even death.
Sometimes even death, exactly. So if that level of pressure across millennia hasn't stopped it, what realistic expectation can we have that, contemporary punishment is suddenly going to eradicate it?
That's a fair question.
If the goal is absolute eradication, the historical record is, it's just not supportive of that method.
And we get the motivation behind the laws, right?
Yeah.
Criminalizing efforts usually come from a very understandable place, often a good faith moral unease.
Sure, concerns about exploitation, coercion.
Exactly. Genuine concerns about harm. And those concerns are absolutely valid.
But the method of intervention, that's everything here. The policy response we see most often is that familiar punishment lever, full criminalization.
And when that doesn't work.
When that fails to stop the activity, the logic almost always circles back to, well, we just haven't enforced the law harshly enough yet.
It's that cycle.
It's that classic repetitive cycle. Policymakers apply the same prohibition logic that was used for things like drug use or, historically alcohol. And the assumption is always that more legal pressure automatically means less activity and therefore less harm.
But the analysis we're looking at really challenges that direct line. Which brings us to this critical dynamic the paper raises.
Which is?
When sex work is criminalized, does it actually disappear or does it just adapt? And here's where it gets really interesting.
Oh, it adapts. The evidence is just overwhelming on this. It doesn't stop. And the way it adapts is so crucial for understanding the policy failure.
Okay, so what does that adaptation look like?
When the law pushes this activity out of the visible world, the policy paper details these really clear shifts. For instance, if it was happening on the street, it moves indoors.
Into places like?
Often into illegal massage parlors or private apartments. And crucially, it moves online, which adds a whole new layer of anonymity for everyone involved.
And that anonymity, that sounds risky.
It can be. And maybe most dangerously, the work starts moving through these unregulated, often opportunistic intermediaries, people who can manage the risks of an illegal environment.
So when we talk about that shift, what's the core mechanism driving it? Is it just convenience or is the policy itself actively incentivizing this hidden risk?
It's the policy. It's actively creating what you could call perverse incentives.
Yeah.
The moment the activity becomes illegal, the entire system begins to reward concealment, not safety. Just think about it practically. If you are working and the police could arrest you at any moment,
Visibility becomes the enemy.
visibility becomes dangerous. Being known, operating in the open. These are now huge risks you have to avoid.
And I can imagine that creates this cascade of self-protective behaviors that are ultimately really harmful.
Absolutely. If a worker is assaulted, for example, reporting that becomes incredibly risky.
Because it exposes them to the justice system.
It immediately exposes them. It turns the victim into a potential defendant. And seeking any kind of help, medical care for an injury, or even just mental health support, that suddenly becomes really costly.
Costly how?
Because it requires disclosure. And that disclosure could lead to severe legal consequences like arrest, fines, or in some places, even losing custody of your children.
So the policy is essentially forcing people into the one working environment that policymakers always claim they want to get rid of, this dependence on third parties.
Precisely, the people who can shield them from the law.
The intermediaries.
Exactly. The outcome, which the analysis highlights, is that the work becomes exponentially more hidden. It becomes more reliant on third parties who take a cut and manage the illegality, and ultimately, it's far harder to leave safely. You have no legal standing to transition out.
And that mechanism, the system rewarding hiding, that's the policy paradox you mentioned.
That's what we have to confront.
Which leads to the really difficult question the paper forces us to ask. If our stated goal is harm reduction and protection, why on earth would we design a system that, just by its effect, actively discourages reporting abuse?
Pushes people away from healthcare.
Makes cooperating with authorities dangerous.
And hands all this leverage to unregulated middlemen.
It's a very uncomfortable truth.
It is. The research confirms that criminalization tends to produce this exact system. And it's not necessarily, malice on the part of lawmakers. It's more of a structural inevitability.
What do you mean by that?
When you criminalize the work itself, you effectively criminalize seeking protection from any harm related to that work.
That concentration of risk. I feel like that's where the policy failure becomes most visible. And it's where the source material gets very specific about economic justice.
Yes.
The harm doesn't just vanish when you pass a law. It concentrates. And it concentrates based squarely on a person's economic leverage.
That's the most corrosive outcome described in the paper. You see this clear division of who carries the risk.
So it's not an equal opportunity risk.
Not at all. People with economic means, savings, stable housing, social networks, they can afford to work much more discreetly. They can invest time in screening clients online. They can get expensive legal advice if they need it.
And, most importantly,
they have the resources and the safety net to just exit the industry when they choose to.
Okay, so now contrast that with people who don't have that safety net.
The contrast is stark. People without money, often marginalized groups working out of immediate necessity, they are forced to take significantly higher risks.
They have fewer choices.
Far fewer choices for screening. They absorb the entire brunt of enforcement pressure because they're often working in more public spaces. And they carry the full weight of the criminal consequences.
So the policy, just by its design, actually achieves the opposite of its stated goal. It ensures that the harm lands precisely on the most disadvantaged people the law claims it's trying to protect.
It formalizes an inequality of safety. It absolutely does.
And you mentioned cost earlier. This sounds like a classic cost transfer phenomenon. The research compares it to the economics of drug prohibition, right?
It's a direct parallel. The societal costs of trying to enforce prohibition don't vanish just because the activity is illegal. They move somewhere else in the system.
Wait, but isn't system strain like courts clogging up or hospitals being busy? Isn't that just a standard part of policing strain? How do we know the policy is the direct cause here?
We know because the nature of the strain is directly linked back to that concealment we talked about.
Okay.
If you look at the data, the cost shifts out of the intended policy sphere, which was stopping the activity, and it flows into these downstream support services that have to manage the fallout of hidden, unregulated work.
So where does that pressure actually show up?
Well, it drains policing resources on arrests that do very little for actual safety. It clogs the courts with low-level offenses. But crucially, look at emergency healthcare.
Right. Well,
They're treating injuries or illnesses that were either delayed or never reported to authorities because the person was afraid of being arrested. The data shows increased demands on mental health services dealing with isolation, trauma, and violence that went unpunished because reporting was just too risky.
So the cost of managing the consequences of concealment becomes this externalized public expense. We might complain about emergency room wait times or court backlogs.
But we rarely trace that pressure back to the policies that actively created the hidden risks in the first place.
That's the key point.
That's the key analytical point. The cost is paid by the public health and social welfare systems, even though the driver was a criminal justice policy that prioritized punishment over any kind of safety mechanism.
Which brings us to the core conflict the paper identifies. And it's a necessary moment of clarity, I think. Protection and punishment are simply not the same thing, even though we confuse them all the time in public debate.
They're structurally opposed, really. If the goal is genuinely protection, the sources state that protection requires a few non-negotiable things.
Like what?
It needs visibility, it needs trust in authorities and medical services, it needs unfettered access to support, and most importantly, it needs the ability to ask for help. From violence, from coercion, without any fear of immediate legal consequence.
And punishment, just by its fundamental nature, is designed to do the precise opposite of all of that.
Exactly. It drives visibility down, it destroys any possible trust in law enforcement, it restricts access to services because of the risk, and it actively penalizes the very act of reaching out.
You can see this conflict really clearly when you look at policy counterpoints, right? The paper mentions other models.
It does. It extensively covers evaluations of models that shift away from criminalization. For example, the long-term evidence from New Zealand's Prostitution Reform Act.
That was the one from 2003 that decriminalized sex work.
That's the one. And it offers a powerful, measurable contrast.
So how does that specific framework show the shift from punishment to safety?
The measurable outcome was a significant decrease in the leverage held by those unregulated third parties.
Why?
Because workers could now operate legally and, crucially, report abuse without fear. The analysis showed improved trust between workers and police, and most importantly, improved health outcomes because seeking medical care was no longer risky. Protection was prioritized by removing the penalties that forced concealment.
So if we step back and internalize all this policy analysis, we get to this reframed question from the material. Instead of constantly hammering on how do we stop sex work, which, history tells us we can't do through punishment, we shift the focus
To a much better question.
to what makes people safer and what makes them more vulnerable. When you ask that question, which is focused on measurable harm reduction, a lot of conventional punitive policies suddenly look like they're actively increasing risk.
And concentrating harm where it can least be managed.
So what does this all mean?
It means we have an obligation, I think, to look at the track record of punishment with clear, evidence-based eyes. And that record consistently shows us that harm doesn't just disappear, vulnerability increases disproportionately, and the costs, they get shifted to other parts of the social safety net.
And ignoring that record doesn't make it go away.
It doesn't change the reality for the people who are actually affected by the law.
For those of you who want to dive into this evidence base further, the policy paper references some very specific types of research.
Yeah, things like academic studies on the direct correlation between illegality and increased violence risk.
There's also World Health Organization guidance on maximizing positive health outcomes for this population.
And as we mentioned, comprehensive evaluations of alternative legal frameworks, like that New Zealand example. The value is in the data.
It is.
And that kind of evidence really leaves us with one provocative thought to mull over as we wrap up.
Okay, what is it?
If morality is the main driver of a policy, but that policy demonstrably increases the very harms it claims to oppose, pushing people into danger and hiding them from help, is the pursuit of that kind of moral signaling inherently incompatible with the measurable, real-world pursuit of safety?